So, welcome to SciCast. I'm Dr. George Grossberg. I'm the Samuel Fordyce Professor in the Department of Psychiatry and Behavioral Neuroscience at St. Louis University School of Medicine. And our topic for today is the microbiome and Alzheimer's disease. So we'll spend about 20 minutes or so going over this important topical area. We'll be talking about the microbiome and kind of differentiating that some from the microbiota. We'll also discuss kind of the evolution of the microbiome and the relationship, particularly between bacteria in the gut and Alzheimer's disease. I'm going to kind of briefly touch on what evidence we have that stabilizing the bacteria or the microbiota of the gut may be therapeutic, not just for Alzheimer's disease, but a variety of neuropsychiatric and medical disorders. And then we'll kind of finish up by talking about what are the treatment approaches that may be possible with this new data and new information that we're learning about the microbiome relative to Alzheimer's disease. So what is the microbiome? So the microbiome is really defined as kind of the entirety of microorganisms that live throughout the body in all the different organs. The reality is, and this would include bacteria, would include fungi, would include viruses, and so on. But the reality is that the majority of the microbiome is actually in the GI tract, is in the gut. And that's called the microbiota of the gut. So this is kind of the microbiome versus the microbiota. Some people use those interchangeably, but really the microbiome is unique to every one of us. It's kind of like a genome. And it's really very different for every individual, whereas the microbiota only refers to the microbes or the bacteria and viruses and fungi that are in a particular organ. And for all intents and purposes, 99% of the microbiome is in the gut. Another term that's important to keep in mind is this concept of dysbiosis. So what is dysbiosis? Well, it refers to kind of a microbial imbalance. And microbial imbalance, particularly in the gut, has been linked not just to Alzheimer's disease and dementia, but has been linked with a number of cancers, has been linked to depression, has been linked to obesity, to anxiety, a variety of kind of inflammatory diseases. So this is kind of a very important area. What we also want to keep in mind is that the balance of good versus kind of bad bacteria is very, very important. But when we can maximize or when we can improve that balance toward beneficial microbes or bacteria in the gut, we can see a lot of benefits. So, for example, the microbes that colonize the gut do a lot of different things. They produce analgesics. They produce some vitamins like vitamin B, some of the B vitamins like B12, vitamin K. They also have antioxidant and anti-inflammatory properties. As we'll see in a moment, these antioxidant and anti-inflammatory properties may be beneficial for inflammatory related diseases. And keep in mind that there may be an inflammatory component even in Alzheimer's disease. We also want to keep in mind that the bacteria in the gut have some day-to-day functions as well. They help to digest food, they break down food, they may communicate, with the immune system. And because they have anti-inflammatory properties, they help to keep inflammation throughout the body kind of at bay. They really help control inflammation. I want you to keep in mind two main species of what we call friendly or good bacteria. One is called lactobacillus, and the other is bifidobacterium. Now, these are long words and they may sound kind of strange, but if you go to the supermarket and pick up, for example, some cultured yogurt, like some of the Greek yogurts, you'll find on the ingredients that they're enriched with the same bacteria, lactobacillus and bifidobacteria. These are the so-called friendly or good bacteria, two of the main species of friendly bacteria in the gut. Now, how do we impact, the microbiome, and how do we impact the gut bacteria or the microbiota of the gut? Well, obviously, one way to think about it would be diet. We know that the Mediterranean diet seems to be the healthiest diet as far as having a good balance of bacteria. We also know that a way to kind of adversely impact the microbiome is overuse of antibiotics. That might skew us toward the bad bacteria. We also know that stress, psychological, physiological stress, can also skew things toward the bad bacteria. There are changes throughout life. Unfortunately, as people get older, there's a tendency to this dysbiosis, kind of the equilibrium in the gut shifting often toward the bad bacteria versus the good. And then, depending on where one lives, different parts of the world, there may be ethnic factors that influence gut bacteria as well. An interesting factor also happens to be whether an infant is breastfed versus bottle fed. It seems like if they're breastfed, there may be a richer array of bacteria in the gut. And then we also have evidence that babies that are born vaginally versus via C-section, cesarean section, and when they're born vaginally, they're bathed in the fluids of the mother and also tend to have a richer array of gut bacteria. So those are kinds of things to keep in mind. Now, what about this birthing method issue? I mean, does this mean that someone who's born via cesarean section is kind of doomed to have bad gut bacteria, kind of dysbiosis of the gut bacteria, that they may be more susceptible to certain diseases? We're not really sure. We think it may contribute. But there was a recent study, actually just published about 4 months ago, that showed that we can alter the balance in a positive way of babies that are born via C-section relative to their gut bacteria by giving what's called a microbiota transplantation from the mother. So we give microscopic amounts of stool from the mother, introduce that into the infant, and what was found in the study was that 3 months later, after the introduction of the bacteria from the mother, stool bacteria from the mother, we see that the infant now is starting to make more and more of the good bacteria, the bifidobacteria that we talked about, and less of the kind of the bad bacteria, the ones that we want to kind of minimize. As I mentioned, the microbiome and the gut microbiota and the changes in the microbiome that affect the gut have been linked to a whole bunch of different diseases. We mentioned some of them earlier, but some others, inflammatory bowel disease, for example. We mentioned obesity, but diabetes is another one. Narcolepsy and even autism, there may be some link. So this is something that's becoming kind of better understood. Now, one question that often comes up, this is a very new area, is what was the first evidence that changing the bacterial composition of the gut in a positive way by introducing healthy bacteria into the gut? It's called fecal microbiota transplantation. Fecal transplantation can be, in fact, therapeutic. What we're doing here is really administering a solution of fecal matter from a donor, a healthy donor, into the intestinal tract of a recipient in order to directly change the recipient's gut microbial composition and hopefully confer a health benefit. So what evidence do we have for this? Where did this all start? And it really all started with a disorder called C. diff. I think you've all heard of Clostridium difficile infections. They are and colitis. It's a very serious infection of the colon, often seen in older adults, often seen in older adults who have been exposed to a variety of antibiotics, which often have wiped out the good bacteria. It can be transmittable, hand to mouth from one person to another. It's quite common. There are nearly 250,000 cases every year in the United States. Now, the good news is about 80% respond to a variety of antibiotics because this Clostridium difficile colitis can be life-threatening, can be very, very severe. There's a toxin that's secreted. These patients have fever, abdominal pain, diarrhea. They can become dehydrated. In fact, they can die from it. So 80% respond well to antibiotics. But what about the other 20%? What do we have for those individuals? Well, we have the fecal transplantation. So what we find is that if we can, in fact, take healthy stool samples, introduce them into the colon of the individual with the C. diff colitis, there's over 90% success rate. So we showed, I think this is already about a decade or so ago, that introducing healthy bacteria into the colon can fight disease. In this case, Clostridium difficile colitis. There are also other kinds of evidence. There's evidence, for example, in animal models showing that the composition of the microbiota of the gut bacteria, is very different in Alzheimer's patients versus healthy age-matched controls. And that if we can, in fact, introduce healthy bacteria, even in animal models, we see that they fight the changes that we can see in the brain in Alzheimer's disease. So because of that, we're talking more and more about what's called the gut-brain axis. The notion that what happens in the GI tract, particularly in the colon and in the small intestine, what the microbial composition is of the GI tract may actually influence what happens in the brain as far as brain diseases like Alzheimer's disease. Another interesting piece of evidence relative to the contribution that bacteria might make to diseases like Alzheimer's disease has to do with the relationship between gum disease, the relationship between gum disease and Alzheimer's disease. So Alzheimer's disease and periodontal disease. We are now starting to accept more and more that people who have periodontal disease versus those who don't, that may be a risk factor for Alzheimer's disease. In fact, fairly recently, a specific bacteria which causes gum disease, it's a long name, it's called Porphyromonas gingivalis, also called PG for short, that these bacteria are actually found not just in the gums causing disease there, but they're found in the brains of Alzheimer's patients in close proximity to the plaques and tangles. And these bacteria secrete a toxin, it's called gingipan, a protease, which is found in high concentrations in Alzheimer's disease brains. And in fact, the same protease, the same enzyme or toxin that's secreted, activates an inflammatory process in the brain. In animal models of Alzheimer's disease, these same gingipans that are secreted by this bacteria promote the accumulation of plaques and tangles and accelerate cognitive decline. The good news is that there are already medications that are in human trials. They're called gingipan inhibitors that may be useful in treatment and potentially prevention of early phase Alzheimer's disease. So, keep in mind this relationship between periodontal disease, the notion that we have a way of blocking the toxin that these same bacteria that cause gum disease that are now found in the brain that may relate to Alzheimer's disease. So this is in fact an avenue of great promise. We also want to keep in mind that there may be a relationship between bacteria in the gut and coronary artery disease or arteriosclerosis. There are a number of animal models that have shown, rabbit models, for example, where they have significant coronary artery disease, that you find this very same pathogen, the same bacteria that we talked about that causes gum disease, that may contribute to Alzheimer's disease, also seems to accelerate atherosclerosis, deposition of lipids in the coronary artery. So this is all a very kind of interesting and very intriguing relationship. Let's also keep in mind that there is now a small biotech company that's actually manufactured a drug that can block these toxins, and that's already in early phase trials for Alzheimer's disease. We also want to keep in mind that there are other ways, besides these new medications that are being developed, that there are other ways of influencing the microbiome. So one would be to think about a probiotic. One can go to kind of any drugstore, any health food store, and you can buy probiotic capsules, which are basically live microorganisms, the good bacteria, which one can take on a daily basis. But another way, and these are fairly costly, may not be the best way to do it, but it's one way to kind of influence the gut microbiota. The other would be to think about prebiotics, not pro, but pre. That would be food sources. I mentioned to you earlier cultured yogurt, yogurt that's enriched with lactobacillus and bifidobacteria, the good bacteria. Other kind of fermented products are also good for addressing the dysbiosis, the notion that the bad bacteria are kind of overwhelming the good bacteria in the gut. Things like kombucha, which is a fermented tea, tempeh, fermented soybeans, even things like kimchi, sauerkraut. But probably the best and the one that's most practical would be, as I mentioned earlier, to adhere to a Mediterranean diet. There's ample evidence that people who adhere to a Mediterranean diet as a prebiotic, they have healthier gut bacteria. Now, if indeed we're moving to potentially looking at probiotics or prebiotics, then the question is, should we be recommending a probiotic and prebiotics for at-risk individuals for Alzheimer's disease? And the good news is this is actually being looked at. So if you access clinicaltrials.gov, you'll see that there are already 2 studies looking at people with pre-Alzheimer's disease who are being kind of exposed to probiotics to see if they may be able to prevent the evolution of Alzheimer's disease from mild cognitive impairment all the way to the disease itself. There's a randomized, double-blind, placebo-controlled study also of using a probiotic in mild Alzheimer's disease to see if maybe it can slow progression in people with very early Alzheimer's disease. We don't have the data yet on this study, but I can tell you that I'm seriously thinking of recommending a probiotic as well as the Mediterranean diet to my at-risk patients for Alzheimer's disease. Now, additional evidence relative to the therapeutic implications of the microbiome actually come from China. And just, it's been about a year ago, approximately, there was a drug that was approved in China called sodium oligomannate, which basically remodels the gut microbiota and suppresses the gut bacterial amino acids that can lead to neuroinflammation and may in fact trigger or contribute to Alzheimer's disease. This drug, sodium oligomannate, was already approved in China because it seems to be able to slow down the rate of progression in mild to moderate Alzheimer's disease. It's actually a derivative of seaweed. And this has already been studied in China, approved by their kind of FDA equivalent, and is now coming to the US for multi-center trials. So look out for this particular drug called sodium oligomannate. In the meantime, the notion of improving microbiome diversity, the notion of improving the good bacteria versus the bad, is going to really rely on either probiotics or prebiotics, like recommending a Mediterranean diet. So I'm going to finish up by sharing with you what I've called R is our division of geriatric psychiatry at St. Louis University, our recipe for Alzheimer's disease patients and for Alzheimer's disease prevention. Number one, very, very important, lifestyle modification. So we encourage activity in 4 spheres. We encourage physical activity, exercise. We encourage mental activity, keep mentally active. We encourage social activity, hopefully after COVID is over and we can again re-engage socially. And we encourage spiritual activity, whether religious or mindfulness, spiritual activity. We strongly encourage treatment and getting under control any and all cardiovascular risk factors, which can also be risk factors for Alzheimer's disease. This would include smoking, very, very big, obesity, diabetes, hypertension, hyperlipidemia. Get all of those under as good control as possible. Because of the data relative to gum disease, good oral hygiene. I'm reminded when I was growing up, my family dentist used to have a sign in his waiting room, and it said something like, you don't have to floss all your teeth regularly, only the ones you want to keep. Because if you don't floss, if you don't have good oral hygiene, you're going to lose your teeth, you're going to get periodontal disease, and maybe be at greater risk for Alzheimer's disease. Another, unfortunately, risk factor, which is hard to control, seems to be air pollution. And a variety of aluminosilicates and other pollutants may also be a risk factor. So again, we try to avoid that as best as we can. We're strongly recommending the Mediterranean diet. We're considering recommending curcumin because there's some data that it might be helpful in slowing the disease, a B-complex multivitamin, maybe an antioxidant like vitamin E, and then of course the whole idea of either a pre or a probiotic may be very useful. And then of course people who already have Alzheimer's disease, combination therapy of a cholinesterase inhibitor with the NMDA receptor antagonist, especially in the early to middle stages, might be useful symptomatically. One risk factor, unfortunately, that we don't yet know how to change, and that's the genetic risk factor. So unfortunately, we can't kind of change our genes as of yet, but of course, we're working on that. So bottom line, take-home messages. We're really beginning to better understand the role of the microbiome vis-a-vis a variety of medical disorders, including Alzheimer's disease, which is our focus today. But focusing on the gut-brain axis is really opening doors to new treatments for Alzheimer's disease and other brain disorders or brain-related disorders. And the first of a possible future generation of compounds for prevention and treatment of Alzheimer's disease, focusing on the microbiome, focusing on dysbiosis of gut bacteria, is starting to emerge. Thank you all very much.